This is a Coin6 special presentation.
Good afternoon, and thanks for joining us. I'm Coin6 News anchor Emily Burris. Health insurance is more important than ever. The American Rescue Plan, signed in February of 2021, extends financial help and increases the amount of financial help that people can get. The Oregon Health Insurance Marketplace is holding a live town hall event this afternoon to answer some of your questions. We want to join them now with answers to the questions you've sent us all week long. Things like if you're eligible for coverage, what type of coverage is available to you, and when do you need to apply during the special enrollment period. We have lots of information to get to. We'll answer your questions and more from our state health officials. Now we'll join this live town hall.
Welcome to the Health Insurance Town Hall.
Thank you for joining the Marketplace Town Hall today. We plan to discuss the American Rescue Plan and COVID-19 special enrollment period. Thank you to everyone who submitted questions in advance. If you have a question, tweet to us at OR Marketplace or visit bit.ly/OHIM_Q-S. This meeting is being recorded for online replay. Good afternoon. My name is Chicky Flowers. I am the administrator of the Oregon Health Insurance Marketplace. We are a state agency that helps connect Oregonians who can't get coverage through a job, Medicare, or the Oregon Health Plan to quality health coverage. Without further ado, let's meet our panelists.
Thanks, Chicky. So my name is Robert Mulcair. I am an independent broker down here in Southern Oregon with Klamath Insurance Center. I've been a partner agent with the Marketplace since about 2019, but our agency's been involved with the program since its inception. Personally, I'm very passionate about health insurance and working with my clients, and so I'm very excited to be here today to go through these questions and see what we can do to help educate Oregonians about getting qualified for affordable health insurance.
Thank you. Hello, I'm Lindsay Shirahama. I'm the Premium Assistance Program Manager at Project Access Now, and I have been helping people sign up and navigate their marketplace plans for about 6 years. Project Access Now is a healthcare nonprofit based in Portland, where we advocate for increased healthcare and social supports, especially for underserved communities. And we also work with regional healthcare systems in the Tri-County area to improve our community's health well-being by creating access to care, services, and resources for those in need. About 80% of our team are bilingual, bicultural, people of color, and first or second generation Americans, reflecting the communities that we serve.
My name is Israel Estrada. I am a regional outreach coordinator with the Oregon Health Insurance Marketplace, which I've been with that agency for 6 years now. As a regional outreach coordinator, my job is to basically spread the information, share that information to make sure that Oregonians have the knowledge that they need in order to get coverage. The area I focus on is Southwest Oregon, which includes Coos, Curry, Douglas, Jackson, Josephine, Klamath, Lane, and Lake counties. So a pretty big territory, but I love my job.
I'm glad you love your job, Israel, and thank you for joining us today to be our panelists. Robert and Lindsay, thank you so much for joining as well. So let's get started. Our first question is, how has the American Rescue Plan affected health coverage? Israel, can you take this one?
Sure. There's a couple of different ways that the American Rescue Plan has affected coverage and financial assistance. So one of the biggest changes is it's removed the cap on how much you can make in order to receive assistance. So that means a couple of things. It means more people qualify, and in addition to removing that cap, it also increased the amount of assistance that people who qualify get. So more people qualify for assistance, and the people that do get the assistance get more help than ever before. So those are the two big ways that the American Rescue Plan has helped. But there also is one additional benefit, and that has to do with unemployment. if you receive even 1 week of unemployment assistance in the calendar year of 2021, you're basically going to qualify for the maximum level of tax credits available to you, because they're going to treat you as if you are in the lowest income bracket when it comes to calculating your financial assistance. And that's what determines how much help you're going to get. So if you receive even 1 week of unemployment, you're going to get the maximum tax credits available to you.
Fantastic. Thank you so much, Israel. Robert, this question is for you, and it comes from Salem, Oregon. Are you able to apply for insurance anytime, or do you have to wait until open enrollment, which starts November 1st?
That is a great question. So this year is a little different than typical years. So right now we're in the middle of a special enrollment period that's related specifically to the COVID-19 pandemic. So right now, anyone who needs to enroll in health insurance is able to get enrolled, regardless on if you were directly impacted by COVID-19 until August 15th. Okay, normal years, generally, yes, you have to wait until open enrollment, which runs from November 1st till December 15th. If you miss that time frame, you may still qualify for a time to enroll, as long as you qualify for some sort of life-changing event, moving, maybe you have a child, you lost other coverage, whatever it might be. There is a list, so you could still potentially qualify, but it's very important to make sure you do enroll and you speak to someone during that open enrollment period so you don't miss out on coverage.
Thank you, Robert. Lindsay, it's your turn. The American Rescue Plan provided increased subsidies to many people, and I've read that the lowered subsidies would be retroactive to January 1st, 2021. By reapplying, we did get the increased subsidies as of May 1st, but when and how will there be a retroactive credit to January 1st? Our insurance company says they know nothing about that.
Well, first off, glad to hear that this person has already reapplied and already gotten those increased tax subsidies. If they hadn't, then that would be the first thing that I would say. That would be step one. Also, they're correct that yes, those tax credits are retroactive back to January 1st, but you won't get them as a lump sum now. You will be able to get them when you file your 2021 taxes and reconcile your premium tax credits. So that means declaring that you had a marketplace plan in 2021 and filling out tax form 8962. And pretty much since the American Rescue Plan wasn't signed until March, the first benefits weren't available till May, then even though right now you are eligible for those higher savings from January through April, and it sounds like at the time you're probably using 100% of the tax credits that you were eligible for, those savings that you're now eligible for won't actually come back to you until you file your 2021 taxes.
Thank you, Lindsay. Israel, this next question is for you. A viewer in Jervis asked, I just got hired and wanted to know if I would qualify for premium tax credits.
That's an important question to ask. There are a couple different factors that can affect whether you qualify for tax credits. And one of the most important ones is whether you have access to coverage from your employer. So if your new job has coverage available to you, it could prevent you from getting financial assistance through the marketplace. However, if no coverage is available, you could potentially qualify through the marketplace, or if your coverage doesn't meet certain either value standards or cost standards, it could also allow you to receive financial assistance through the marketplace. And just as a reminder, the amount of financial assistance you're going to qualify for is dependent on how much you make. So it's going to be your household income that determines how much you qualify for. Whether you have access to other coverage will determine whether you qualify for financial assistance. And then just for that particular situation, just something to keep in mind is that sometimes there's a gap between when you start your new job and when your coverage can begin. And if that's the case, then you can get the coverage through the marketplace for those months until your coverage through your employer kicks in with the assistance with financial assistance, assuming you meet the other qualifications. So I hope that answers your question.
It does, and more. Thank you, Israel. Robert, someone in Portland asked, it is likely that I will lose my health insurance, which is currently provided through my employer. What is the best way for me to find coverage for my husband and I in order to prevent a gap in coverage? if we won't have access to coverage through an employer?
You know, that's another really great question, and it's awesome that you're looking at it ahead of time. It's terrible that you're potentially losing coverage, but by looking at it ahead, you have 60 days before that change event. So 60 days before you lose coverage, to be able to go onto the marketplace and get enrolled in coverage. You're able to go on. You can do your shopping and see what the best plan is that works for you. And then what'll happen is your next insurance plan through the marketplace will start the first of that next month after your group coverage ends. You can go on. There's lots of different resources to go on and find these plans. The easiest one is if you go to OregonHealthcare.gov. You can go on there and you can window shop for plans. You can look for what my recommendation is, look for local help to help you with these plans. I never advise someone to try and do it on your own. There are lots of people out there, lots of agents like me. You have people like Lindsay, Israel. We're here to help and we want to help. So use us, and we're free.
Thank you, Robert. Lindsay, another Portland viewer asked, I am over 70 years old and a green card holder with no job, and I'm now living with a family member. How can I access health insurance and medical care?
This is also a really good question. Because you're over 65, it's also a Medicare related question. So if you do not qualify for premium-free Medicare Part A, then you can shop through the marketplace and you may qualify for financial help. But if you're eligible for free Medicare Part A, then you cannot go through the marketplace. And I would, reiterate what Robert just said. I'd recommend getting help from a local insurance agent or a community partner to help us, let us help you get connected to the right program, financial savings. Again, we're free, and you can find local help at OregonHealthcare.gov.
Fantastic. Thank you, Lindsay. Israel, can you please take this question from Bend? My wife and I are moving full-time to Bend by mid-August 2021. We currently live in California. I am 66 and have Medicare coverage through Kaiser. My wife is 64 and has Kaiser coverage. What do we need to do to obtain health coverage in Oregon? We are both retired and live on limited rental income. Please advise and thank you.
Yeah, thanks for your question. First of all, welcome to Oregon. A couple different things to do. First of all, glad you're being proactive about this, because what you're going to notice when we answer a lot of questions is that time is a factor. A lot of times when something happens, you have a limited time to take action. So first thing you're going to want to do is notify your current companies, the regular Kaiser coverage and your Kaiser Medicare coverage. Let them know that you are moving out of state, because you're going to be moving out of their service area, and one of your responsibilities as a customer is to notify them of this. Now, moving to a new state is going to trigger an opportunity for you guys to make changes both on the Medicare side and on the marketplace side. So you, moving to Oregon, you'd want to look for Medicare plans that are available for the Bend area. Your wife would want to look for marketplace plans available in that particular area. And this is a good opportunity, since you're brand new to the area where you may not know what's available, to talk to somebody like an agent in your area, like Robert. He's not quite in Bend, but closer than I am. Or you can work with someone like me to let you know what your options are, because help will be available for your wife for the marketplace. And then also there is assistance for you when it comes to the Medicare side through an agency called SHEBA, Senior Health Insurance Benefits Assistance, which you can find at sheba.oregon.gov. They specifically work with Medicare counseling.
All right, thank you, Israel. If someone is receiving marketplace coverage and qualifies for tax credits, but their spouse's company has elected to add spouses to the company plan, will that person lose their tax credits if they want to stay on the marketplace? Robert, can you take this one, please?
Of course. This whole event's just chock full of really good questions that are really all of us that do this. These are questions that we get every day, that getting health insurance is very, very complex if you're not familiar with what you're looking at. Short answer to this is if dependents and spouses are offered coverage by an employer, you may be ineligible for tax credits. So what's key is you have to look at, they call it the affordability standard on the employee plan, and the minimum value. If the plan that the employer is offering meets those standards, then no, you would not qualify for tax credits. This is something that my little plug, if there's any employers here, it's definitely something you need to talk to your agent or whoever you're talking to, because you may inadvertently affect your employees and their families trying to do something good and not realizing that you could be having a negative impact on your employees.
Thank you, Robert. Lindsay, can you tell us what happens when you lose a dependent during the year, either to marriage or unfortunately to death? Do you have to pay back the credits you received for that person, even though they were your dependent for only part of the year?
It is possible that someone would have to pay back tax credits for those dependents. Pretty much the goal with your marketplace application account is to report the same information on that you'll be putting on for your taxes for the same year. So 2021 marketplace application, 2021 taxes. So if you know that like your kid is getting married or they're going to be filing as single for 2021, then they shouldn't be listed as a dependent on your marketplace account. Really, anytime that you know that there's a change that could impact your taxes, such as like marriage, divorce, a dependent passing away, update it on your marketplace account. And the marketplace will then recalculate the financial assistance that you're eligible for. And then when you file your taxes at the end of the year, the IRS will reconcile the tax credits that you used against what you actually qualified for. So then if you use more tax credits than you're eligible for, then yes, you may have to pay something back.
Thank you, Lindsay. Israel, someone in Westland is asking, I am retiring before the end of this year, 2021. I have dependents that do not qualify for Medicare. My wages after I retire will be savings and Social Security only. Does the balance of the family qualify for subsidies under the Affordable Care Act?
Well, thank you for your question. Whether your family qualifies or not, so far I don't see anything that would prevent them from getting that financial assistance, although always remember that the actual determination is going to depend on a couple different things: the size of your household, how much you are making. It sounds like your income's gonna be on the lower end of the scale, so it's quite possible that they're going to qualify for financial assistance. But if they don't have access to other coverage, then they could potentially get financial assistance through the marketplace. And something key to remember is that they're going to have 60 days from the last day of your employer coverage. So when you retire, that coverage is going to end. They're going to have 60 days from the end of that coverage in order to take action. So remember, Robert mentioned this earlier, we have some limited windows, limited opportunities for when you can enroll. So it's going to be really important for them to take action quickly in order to make sure that they get benefits.
Thank you, Israel. Robert, we got this question from the Eugene area. If someone is receiving marketplace coverage and qualifies for tax credit, my apologies. I don't know if that was a duplicate, but anyway, I'm going to ask it again. Robert, we got this question from the Eugene area. If someone is receiving marketplace coverage and qualifies for tax credits, but their spouse's company has elected to add spouses to the company plan, will that person lose their tax credits if they want to stay in the marketplace?
Yeah, so Chicky, that's very similar to the one that was asked earlier, but something else to consider. So let's say an employer makes a change mid-year and decides, now that they're going to add the dependents and spouses to the plan, but you've been receiving tax credits and have been on the marketplace plan until now. Just like what Israel just said, what Lindsay has said, we have a limited amount of time and we want to make sure that we get changes added to your marketplace application as soon as possible. So if they do make that change, you'll want to make sure you talk to, an agent, community partner, see if that plan, your employer plan, meets the minimum value standard. And if it does, then we're going to want to get that application changed so that we can get the tax credits adjusted. So if they don't get adjusted real time, you may or may not have a tax liability at the end of the year because you'll have to repay those tax credits back.
All right. Thank you, Robert. Lindsay, a viewer in Jacksonville asks, we can no longer afford our health insurance. Where do we start?
Yeah, I thought that was an interesting question because it sounds like this person's income may have decreased recently. So the first thing I would ask is, have you already re-enrolled in your current marketplace plan? Because if you haven't, then that would be step one, because those higher tax credits might make up the savings that you need to be able to afford your marketplace plan. Otherwise, if your income has decreased enough to make you eligible for Oregon Health Plan, then maybe you're eligible for Oregon Health Plan, which is free. So what I would say is update your information on your marketplace account. If you're eligible for OHP or Oregon Health Plan, then your application will be sent to Oregon Health Plan to review it. And then if you do get approved for OHP, then cancel your marketplace plan right away. You don't want to have both at the same time. Otherwise, if neither of those options seem like helpful, then I'd recommend going to healthcare.gov and getting previewing the plans and savings that are available. Maybe just changing to a less expensive plan is the best option, or call an agent, call a community partner. Again, we're resources and we want to help, and our help is free.
Help is indeed free at OregonHealthcare.gov. Come go check it out. Thank you, Lindsay. Israel, this question is for you. What coverage is available in Oregon? Do I have more than one plan option?
Yes, you do. The coverage that's available is dependent on where you live. So typically the county that you live in is going to determine how many plans and how many companies are available to you. The good news is that here in Oregon, every county in Oregon has at least 3 different companies offering plans and a minimum of 15 plans available. So every Oregonian is going to have at least access to 15 plans. And many parts of the state, like the Portland area, are going to have even more companies, even more plans available than that. So that's one of the real positives about this program, is that there are many, many options available for you. And if company A is not going to work for you, then perhaps company B will work for you. And just to name a few of the companies that are out there, we've got companies like Moda, Providence, Regents, Bridgespan, plus a few others that are available depending on what location, what county you are in Oregon.
Thank you, Israel. All right, Robert. Health insurance seems overwhelming, and I'm not sure what to do now. Is there help available? Robert, hit me up.
Yeah, so there's a lot of help out there. So, you have independent agents and brokers, you have community partners. There really are a lot of resources out there. And unfortunately, what happens is a lot of people will fall into the trap of Google, and they'll click the first thing that shows up. And then they're into some sort of private marketing company that really their goal is get your information, sell it. And then magically, as soon as you hit that blue button to submit, your phone blows up and you're getting phone call after phone call. And unfortunately, they're not local people that are able to help you in the same way. Here at my office, and I'm sure Lindsay and Israel have the same story. So many times people come in and they're defeated, they're overwhelmed. They think there's no options available to them, and they're resigned to the fact that they're going to walk out of the office without health insurance because there's no way they can afford it. But come in and talk to us. While I can never make guarantees, I can promise you that we can help get you set in the right direction, whether it's enrolling in individual health insurance, finding out what group options work, going the OHP route, whatever it is, there's resources to help, and we don't cost you anything. We are free help. Whether you go to an agent, a nonprofit, I can't say that enough. We are free. Use us. We're here to help and want to help. And again, in case you forgot it, we've said it a couple times. If you want to find local help, you can go to OregonHealthcare.gov, hit the Find Local Help. It's pretty easy. And it'll give you a list of everyone in your area that's available to help you with these questions.
Fantastic. Thank you so much, Robert. Lindsay, if someone is currently enrolled in a marketplace plan, how do they receive additional premium tax credits to help lower their monthly costs?
You just have to re-sign up for your same plan. So there are a couple ways you can do that. You can log into your Marketplace account, click on your 2021 application, report a life change, and just reconfirm your information, make any updates that you need. You can call the Marketplace, do the same thing. You can call an agent or call a community partner. And again, like I want to reiterate what Robert said, we are here to help. We are free. We really want to help. And we don't want you to fall into that Google trap of ending up with your phone blowing up with, kind of scammy calls. Other thing you can do, which we don't really recommend, is that there's a possibility that your new tax price will be automatically redetermined in the fall. However, if you've had any kind of income changes, dependent changes, if you've moved, then your information might not be correct. So give us a call.
Thank you, Lindsay. Israel, I'm on COBRA and paying nothing for premiums right now, but that ends on September 30th. Can I enroll in the Marketplace after that?
Oh, wow, COBRA question. All right. So I'm going to give a little bit of context for people that aren't familiar with it. But one of the benefits that was also included with the American Rescue Plan is that the feds were offering to pay for COBRA coverage for a few months. And just like the person stated, that benefit's going to be ending soon. So when that happens, you will have an opportunity to enroll into the Marketplace. So we talked about things that allow you an opportunity to make changes. One of the things that allows you an opportunity to make changes is losing financial assistance towards your COBRA coverage. So if you're receiving that benefit from the feds and that benefit's going to run out in August, you'll have an opportunity to enroll in a Marketplace coverage, apply for financial assistance, hopefully qualify. But just like everything else we've been discussing, time is a factor. You're going to have a roughly a 60-day window to take action on that. And if you don't, then you'll have to wait till the next open enrollment period to enroll into the Marketplace. So if you're one of those people that's going to be affected, please take action as soon as possible. And you also don't want to have that big gap in coverage either, if you can avoid it.
Thank you for the good advice, Israel. Israel, I have one more question for you. Am I eligible for Oregon health insurance if I'm qualified for VA healthcare so that I can choose one or the other? Israel, what's your take on this?
It's really going to depend on the type of coverage that you're getting. If you're on there's VA coverage, but there's also, like, if you are on an actual plan like CHAMP or TRICARE, it really could affect your benefits. I'd need a little more information to tell you for sure, because I need to know which of those benefits that you're receiving. But generally, if you are a person that can only receive care at a VA facility, but not anywhere else, typically in that situation, you could potentially qualify for a Marketplace plan and for Marketplace financial assistance, but it will depend on what type of care you are receiving from your military service.
All right, thank you so much, Israel. Thank you so much for tuning in to today's Health Insurance Town Hall event. Thank you to everyone who submitted questions. We received more than there's enough time to answer, and we will follow up directly if we weren't able to answer your question during the live event. And please follow the Oregon Health Insurance Marketplace on Facebook, Instagram, LinkedIn, and Twitter for more answers and helpful information. A special thank you to our panelists, Robert, Israel, and Lindsay, for joining, and to Coin News for streaming the event live on Coin TV and the CW. As a quick reminder, if you or someone you know would like to explore health coverage options, get a preview of savings, or find local help, visit OregonHealthcare.gov. Again, that's OregonHealthcare.gov. Have a happy and healthy day, everybody. Thank you again.